My name is Dr. Alice Newton. I'm the medical director of the Child Protection Team at Children's Hospital and at Massachusetts General Hospital. Unfortunately, there are a number of children who are abused and neglected in Massachusetts, approximately 20,000 a year. At our hospital, we have a multidisciplinary team which helps assess children who've been abused and neglected, and also which strives to prevent child abuse. We'd like to enlist your help today in identifying children who may be abused and neglected so that these children can get the proper help that they and their families need. Children are often injured in settings where their behavior doesn't match their parents' expectations. Little children and older children are especially vulnerable at times when their behavior can be provocative. So times like toilet training, or times when they're learning a new skill such as walking or learning to develop language. And at these times, children often have more provocative behavior. They often fall apart in other ways. So a child who's learning to walk and talk often loses the ability to sleep through the night. And for parents, this can be very frustrating. Unfortunately, there are some parents who are not equipped to deal with this frustration and who end up hurting their children. Now, there are certainly some types of injuries that we see in children that we don't consider to be concerning for abuse. So an active school-aged child may have bruises on their shin, may have a cut on their arm. A child who's just learning to walk may fall and get a cut on their forehead or a bruise on their forehead. And we understand that these types of injuries happen in everyday life. However, there are certain types of bruises which we find concerning. Another setting where we are concerned is if a child comes in with multiple injuries all over their body. Children may have several bruises on their shin, but we don't expect children to have bruises all over their body, in their torso, their shoulder, their legs, their arms. And if these bruises appear to be of different ages, this is also of concern. Sometimes we even see children who have been hit or slapped, and one can identify the appearance of a hand mark on the child's face or body. We also are concerned if we see children who have a pattern bruise. Sometimes we see children who have a bruise from a loop mark, from a belt or an electric cord, or we may see marks, ligature marks around the wrists, or other types of pattern bruises such as a pattern that might happen when a child is hit with a hairbrush or some other instrument. And certainly if you see a bruise that has a pattern to it, that is a very concerning situation. In conclusion, we rely on caretakers such as yourself to help us identify child abuse and neglect. Use your common sense and your experience with children. If you see a mark or a bruise or another finding that raises concern, don't handle it yourself. Report it to the Department of Children and Families so that you can get assistance in helping the child be evaluated for abuse or neglect.